over the last 3 years, things have shifted a lot in our work environment and our workforce. We went, I think that summer, June 2020, we told all our team that was remote. We basically said, hey, if you are remote now, you can stay remote indefinitely. We're seeing good productivity and it's working out well. And from an IT perspective, we are not in the hospital. Like we are actually already in a shared services facility. So we're already offsite anyway. So we were able to retain a lot of employees that way. Actually, we've had employees that have moved because spouses got other jobs in other areas or out of state. And in the past, we wouldn't have kept them, but now it doesn't really matter.
Welcome to the Risk Never Sleeps podcast, in which we learn about the people that are on the front lines delivering and protecting patient care. I'm Ed Gaudet, the host of our program, and today I am pleased to be joined by Will Landry, the SVP and Chief Information Officer for Franciscan Missionaries of Our Lady Health System in Baton Rouge, Louisiana.
That's right. Thanks. Thank you, Ed. Thanks for having me.
Yeah, Will, welcome to the program. I saw you worked at BCBS too at one point.
I did. I was at Blue Cross Blue Shield, Louisiana for a couple of years. I was primarily, I was there for a couple of data center migrations.
Oh, okay,
and,
great.
And they had some on-premise data centers, and we migrated to some colo facilities. It was basically 2-year projects that we finished in 18 months, and then kind of moved on to do something else after that.
We know them well. We do some work with them today. So
awesome.
Let's start off with tell our listeners a little bit about yourself, your role, and a little bit about the organization.
Sure. So my name is Will Landry. I'm the Senior Vice President and Chief Information Officer for the health system. I've been with FMOLHS for 4 years, a little over 4 years now. Prior to that, I was with Lafayette General Health, another health system in Southwest Louisiana. And then for 5 years there, and then with Blue Cross Blue Shield, Louisiana, and with a large home healthcare and hospice company called Missionaries. And that's also in Baton Rouge, but it's a national home health and hospice company. And prior to that, that's my healthcare experience. Prior to that, my experience is all in the retail, wholesale / John Deere industry. So my dad was a design engineer for John Deere and ended up being a president and general manager of a John Deere dealership for a long time. And that's all of my jobs through middle school, high school, and college were all working at John Deere dealerships. So
awesome. Well, John Deere makes a phenomenal product. So
they do. And so what I do, like at FMOL, I'm responsible for all IT, all technology and innovation as well too, and all of our digital space. So we are a large Catholic health system based in Baton Rouge, but we have 10 hospitals in Louisiana and Mississippi, and over 300 ambulatory locations, like clinics, in both of the states as well. And so we have a large footprint of technology, and all those locations. We have over 40,000 active users within our environment, of which 20,000 are employees. So we basically have a lot of contractors, a lot of physicians and outside staff, and we also have a lot of independent partner facilities they're independent, but we provide our medical record to. So we use Epic as our medical record. So we have a Community Connect program where we provide IT services and that EMR to other independent facilities. We have a lot of different smaller ambulatory clinics, but we also have 3 inpatient facilities that we do that with now as well too.
Cool. So as you look over the next 12 to 24 months, what are the top 3 to 5 priorities you're focused on?
I'll give you our main 3 strategies. Our first is just consumer experience and optimization. So we have spent a lot of resources and assets and money on implementing new systems, whether it's Epic, whether it's our new ERP with Oracle Cloud, and we've done a lot with our Microsoft products and tool sets and different technologies that we've put in place. And now we're focused on optimizing and getting more out of them, but also improving the consumer experience. In healthcare, we talk a lot about reducing clicks for providers, but we want to reduce clicks for everyone, not just providers, but for our nursing teams, for our back office staff, for our shared services staff. So we want the technology to be simpler and easier to use for everybody, so that they're focused on what they're good at and focused on being more productive and not just focused on using the technology. the second area where we're like really have heavily focused on is it's kind of three-pronged, but like is refs like our revenue cycle operation or billing operations, and using artificial intelligence and AI and analytics to do that better, and to be able so that we're billing better, that we're coding better. And it's not just about like increasing revenue and making more money. It's so that it's right. We want it to be right, and the billing is right for the patients and at the end of the day. So those are the things that we're really focused on that. And obviously using our data, we've made investments in these systems, and now we want to be able to utilize the data for analytics, for social determinants of health, and being able to help the communities that we serve. And then the third strategy that we're really focused on this year, they're kind of two, sometimes opposite, but we have them together as one strategy because they're so complementary, is cybersecurity and interoperability. Like we have to be secure, and we also have to share data. And so we have to do both things very well. And that we are really focused on improving both of those areas.
Well, that makes sense. I could see that with the ONC and the interop rule. So that does make a lot of sense that they're together. But you're right. There's some tension there between enforcing the control and opening it up to share the data to patients and partners. So I love the way you think about that. How did you get into healthcare and IT in general?
Yeah, so IT has always been a passion of mine. I've had since, and I'll attribute this to my father, but I've had a PC since I was 3 years old. I had an old IBM PC Junior. Like same time when the Kennedys and the Commodore 64s were out there, I had an IBM PC Junior that my dad made an investment in, and it definitely paid off in the long run for me, at least. That is something that really gave me a passion for how does this work. I've always wanted to know how things work, how they're built, what's behind this that makes it tick, and then through middle school and high school, I got into coding, and like also my elective classes in high school were all like programming. We did Turbo Pascal and C++.
Turbo Pascal, yeah, I know it well.
I probably don't get a lot of Turbo Pascal mentions recently, but
I met my wife in a Turbo Pascal class. So
and then when in college, like I majored in information systems, and my programming classes were all my easy A's. Like that was, and then so I've just always had a passion for that. And then how I ended up in healthcare, I was doing, like I mentioned earlier, my early background is a lot of John Deere and like a lot of agriculture, commercial equipment industry. I was doing IT in those areas, but I ended up I had to do something different because my parents' company, like they sold it, they retired, they did something different. So I was looking to just do something different, and I stumbled upon an IT operations manager job at a Medicis, and I never had even considered working in healthcare. And I really got kind of connected to the purpose of healthcare. And our leaders had to do at one point, they asked all of our leaders to do like ride-alongs with some of the nurses to kind of like get an idea of what they do on a daily basis. And it really hit home like how hard healthcare is for me to see that firsthand. And it really, I'll never forget that, because it's really reminded me like what we do, like from a technology perspective in healthcare, is we are trying to make their job easier, not harder. And we have to keep reminding ourselves of that all the time, that the technology is to try to make them more efficient and more effective in what they're doing so that they can care for the patients better. And that is always, and then also too, along with that part, I learned later when I was in Lafayette General, I really learned and hit home that when we provide these EMRs and electronic medical record systems in healthcare, it's interesting because we're in an industry where we're providing a service that our users really don't want, because that's changed over time. But like not long after the Affordable Care Act, there's a lot of negative feedback from providers and nurses about having to document electronically. And so we have a lot of pressure to deliver systems that, that are that their uptime's 100% and that they're not a hindrance to what they're doing. And so it is it's a little bit different that we have that's a really high bar that we have to set, and we're constantly trying to improve that.
Yeah, I remember that you mentioned saving clicks, and I remember the first time I heard that, the light bulb went off. And since then, this is back in 2009, 2010. That's been my center for design as I think about designing products for healthcare. It is that notion of saving clicks and reducing that burden of IT on the provider and support folks that are trying to provide services to the provider. So,
Absolutely.
yeah, no, that's a great point. I'm glad you brought that up. So lot obviously happening, I'm sure, in your world. What keeps you up at night?
I think what keeps me up at night is just availability of our systems, and that's obviously from cyber attacks or even from physical failures and hardware failures and things like that. And we as we become, as not just the healthcare, not just our industry, our company, but like as consumers, we are way more dependent on technology than we were a year ago, than 5 years ago, than 10 years ago, right? And our expectations of uptime and access to these systems has increased exponentially over that time period too. So being able to keep these systems online and available, that obviously keeps me up at night.
Yeah, I imagine that's like for any type of critical system, that's the number one feature. If it's not up and running and available, it doesn't matter what's behind it.
That's right.
So tough couple of years with the pandemic. What are you most proud of personally or professionally over the last couple of years?
What I'm most like, so what we've been able to do, I would say, like during the pandemic, I remember I was sitting in this office, and our VP of Rev Cycle sits right next to me, and she came in here. This was like 3 weeks. It was probably like late January, and was basically was like, "Hey, this thing in China, be prepared to have people go home because we had an ice storm a few years ago, and our VPNs didn't work." And so I was like, "Oh, okay." So we actually started. And I just started. I think I was like 2 weeks into the job here. I didn't really know the history of how when it all went down. So I got with our director of infrastructure and our network teams and stuff. We started actually planning some stuff out. Like, hey, if we had to send a lot of people home, like, could we do it? And the answer was like, no. But this was, I remember, I think we sent everyone home on like March 26th or something like that. It was somewhere in that time frame.
Yeah. That sounds about right.
And we were upgrading circuits, putting stuff in place. Like we were scrambling to do all this stuff. And I think we were a few weeks ahead of a lot of other companies because we were getting really good lead times from our providers and our ISPs, and they were like happy to do it. And like we were turning up circuits and gig circuits everywhere. And I will say that I was very proud of that because we did not miss a beat when we sent people home. We had hardware, like technology ready from a bandwidth perspective. And that was really great. The other thing I will say that we've done is we've had a really good, over the last 3 years, where things have shifted a lot in our work environment and our workforce. We went, I think that summer, June 2020, we told all our team that was remote. We basically said, hey, if you are remote now, you can stay remote indefinitely. So if you like working from home and you are like deciding whether or not you want to put an investment into a home office, go ahead and do it. Because if you want to stay, we're seeing good productivity and it's working out well. And from an IT perspective, we are not in the hospital. Like we are actually already in a shared services facility. So we're already offsite anyway. So we were able to retain a lot of employees that way. Actually, we've had employees that have moved because spouses got other jobs in other areas or out of state. And in the past, we wouldn't have kept them, but now it doesn't really matter.
Yeah. Are you still in that posture? Are you still having people work remote?
We do. We still have, we have right around 500 people in our IT that are like full-time employees. And, we have on-site positions that have to be on-site, our PC techs or telecom techs, and they're doing like actual on-site work. So, but we have about, let's say 350 that are eligible for remote work, and out the 350, we probably have 310 that are remote.
Oh wow, that's great.
Well, it's a pretty high percentage of remote.
Yeah.
So I come in to get out of the house, but a few others that are like that too.
Yeah, I imagine.
I laugh because my wife and kids know that too. But I need a change of scenery from time to time. But
I hear you.
It's been good. I think our biggest challenge is like we've had to find new ways to communicate. We have to find when we bring on new hires or younger, or not necessarily younger, but like less experienced staff, like less experienced enterprise IT or healthcare IT, we've had to train differently. We've had to mentor differently. And I'm not sure that we're doing that as well as we were doing before, but we have other productivity gains that we didn't have before. So
cool. Are you finding ways to bring people back in on a more frequent basis?
Yes, we're doing things like more. We probably have more parties and tailgates and all kind of stuff to do things on site. We'll do some team meetings a couple times a year where we bring people on site, like where we have, and it's a lot more about fellowship and networking than it is about the meeting itself. And so we're doing a lot of that too. We've encouraged our team members. We're doing something this year that we haven't done in the past, and we've already seen some positive outcomes from it. Instead of coming back into the office, which is a shared services office and it's not the hospital, we're encouraging our teams to like have so many visits in the hospital or in a clinic per year to go actually sit on site, that's what we want. We want more. To go see what the users are doing, how they're using the systems versus coming sit in. It's not like every day, but it's a few times a month or a few times a quarter. And
I like that.
What we can make work out. And that's not only like as our team like enjoyed it and got a lot of good feedback from it, our community, our end users and our customers are really enjoying seeing that as well too.
Oh yeah. Well, the providers can say, look at all these clicks. I need to get rid of these clicks. I remember a couple of those sessions.
That's
right. So outside of healthcare and IT, what are you most passionate about? What would you be doing if you weren't doing this job?
Playing with my kids. Yeah. I have an 8-year-old son and a 4-year-old daughter.
Oh,
I have young kids, and so we do a lot of basketball, a lot of playing outside. We go to a lot of like events. I have LSU season tickets for football and basketball. Nice. So we go to. My son and I go to a lot of football and basketball games together, and then I love I'd really like doing electrical work. That would be. I always say that if I had to change careers or if I came back in a different life, I might be an electrician. And I'm not very good at it. I just like doing it. Yeah. So it makes the wrong idea. So.
Nice. And I noticed the bobbleheads on your credenza there, or your
shelf. Those are for lots of different games and events, and some of them are from gifts from people. And I don't think I've bought any of those. I think they're all like either gifts or events. Like you go to a bobblehead night and you get a bobble. So that's what some of them are. I got a couple. Like I got a Pelicans player, a Philly player. I used to live in Baltimore, so I don't have an Orioles bobblehead, but I need one. But I've actually had a few different Phillies bobbleheads, and this is my probably most unique one. It's the Pelicans King Cake Baby. It's their mascot during the Mardi Gras season.
Well, you mentioned Baltimore. Guess whose birthday it is today?
Oh, well,
Edgar Allan Poe.
That's awesome. So I always love the three Ravens mascots. It is our Edgar Allan and Poe. So
that's right. It's pretty cool. All right. So if you could go back in time, what would you tell your 20-year-old self?
I think I would tell myself two things. I would tell myself, like, one, keep working hard. The hard work pays off, and it does. I'll tell anybody that today, And the other thing is that you don't know everything. Although I'm pretty convinced my 25-year-old, even if I told my 25-year-old self, he would disagree. He would definitely think he knew everything.
You'd be fighting with yourself.
Yes, but I think that's key for anybody in their 20s to hear.
Yeah, yeah. No, nobody wants to hear that when they're 20, 25 years old. What are you talking about? I'd be remiss if I didn't ask you this question. This is the Risk Never Sleeps podcast.
Sure.
Will, what's the riskiest thing you've ever done?
I think the riskiest thing I've ever done, I was thinking about this the other day. It's probably, my buddies and I, my brother and two of my really good friends from high school and college, we went whitewater rafting in 2015, and it was an overnight trip. And we picked one of the hardest rivers. And the four of us had never really been before, but it was like a level 4 rafting trip.
Where was it? Local or?
No, it was in California. It was out right outside of it was on the Tuolumne River right outside of Yosemite, and it was really fun, but it was we tumped the boat once. It was pretty risky.
Oh boy. Anyone get hurt?
No, we didn't.
Oh,
But
that's good.
we went like the first week. I think it was the second week it was open, and the water temp was like 45 degrees. It was really cold. So when you hit the water, it was just really cold. But we had a great time. It was fun. But it was looking back on it, my buddy and I were talking about it lunch the other day. We were like, that might not have been our best decision.
Never is, right?
No.
Sounds good on paper.
Yes.
All right. So music or movies for the next question?
Movies.
All right. You're on a desert island. You can bring 5 movies with you. What would they be?
Any Star Wars movie.
Okay.
I'm good. I might pick some others. Like I could probably watch silly movies. Like I could watch the Wayne's World movies over.
Oh yeah,
Definitely.
Love it. Yeah,
probably the Back to the Futures and definitely
Back to the Future. Yep, Airplane.
Yes, but Star Wars movies, I can watch any Star Wars movie all the time.
So did you play D&D as a kid?
I did not.
Oh, okay.
I never did. No, I was into I played a lot of computer games. Like I was really into King's Quest. I really like the King's Quest, like the text-based, like kind of adventure-based games.
Yeah.
When I was younger, but I never played Dungeons and Dragons.
Oh, all right. Okay. So last minute comments or advice to those folks that are thinking about getting into healthcare, IT, or cyber.
I think my advice is it is a very rewarding career, but it is hard. Healthcare and cyber, and then you add them together. It's very hard, not for the faint of heart. But I think that with anything, the harder it is, it's not made for everybody. And I think that you can, you can be very successful with a lot of hard work. But I think you have to be very diligent in making sure that, from a security perspective, obviously, because your users are your access. People don't. Naturally you want open access, you want to be able to use systems, but you also want to be able to secure it. So there's, like we talked earlier about interoperability, security, or sometimes pulling in opposite directions. I think with any system and securing it, you're going to be pulling in opposite directions. And it is something that, it's not easy. It's not for the faint of heart, and there will be a lot of long nights, but it is a very rewarding career.
Yeah. And you can have some fun too.
Absolutely.
Absolutely. All right. Well, we've been talking to Will Landry today with FMOL out of Baton Rouge, the Franciscan Missionaries of Our Lady Health System. This is Ed Gaudet from the Risk Never Sleeps podcast. Remember, if you're on the front lines protecting patient safety or delivering patient care, stay vigilant because risk never sleeps.